Hello, everyone. Welcome to another review for our lab students. And today we shall focus on rapid pulses. Rapid pulse is also known as fast pulse, SHU MAI. Parang ginutom ako bigla. Okay. The rapid pulse is more than 5 beats per respiration, which indicates heat. A rapid and powerful pulse is due to exuberance of pathogenic heat with accelerated movement of qi and blood. A rapid and powerless or forceless pulse is due to yang deficiency. Okay. The rapid pulse is usually a pulse where there are more than 80 beats per minute. What defines a rapid pulse will depend on the person's age. Okay, so when you have rapid pulse, this is always a sign of heat. And we know that heat agitates the heart, accelerating its circulation of blood. The strength of the pulse will determine if it is yin deficiency heat or excess heat. The depth of the pulse will determine in which aspect of the body the heat is located. Even though a fast pulse always indicates the presence of heat, the opposite is not always the case. There are several situations in which the pulse is not rapid, even though there is heat. In some of these situations, the lack of speed in the pulse has diagnostic relevance. In others, it does not. Some of the reasons that the pulse is not rapid despite the presence of heat are: number one, the person plays a lot of sport or is very physically active. The person takes medication, old age, damp heat, phlegm. The heat is chronic and has weakened the qi. Mixed patterns where there is both heat and cold, concurrent kidney yin deficiency and kidney yang deficiency, true cold, false heat. There are also situations where the pulse is rapid, even though the person does not have heat imbalance. This will usually be due to the temporary presence of heat in the body. For example, because the person has just run up the stairs, which will have generated warmth in the body. The person's face will be red, they will sweat, and their pulse will be faster than normal. These are all heat signs, indicating that the person has heat in the body right now. This is, however, a temporary condition with no diagnostic relevance. Other conditions that can cause the pulse to temporarily accelerate are mental stress, no? Irritability and anger, shock, overexertion in a patient who is qi and blood deficient, and nervousness. So the pattern of imbalance is heat. If the pulse is rapid and without strength, it is yin deficiency heat. Rapid and forceful is excess heat. Rapid and superficial, invasion of exogenous heat. Rapid and deep, internal heat. Rapid and slippery, phlegm heat or damp heat. Okay, so as mentioned earlier, the pulse is rapid and beats over 5 times per practitioner's breath. So that is between 90 to 140 beats per minute with a regular rhythm. The pulse frequency is more than 5 beats per breath. Okay, so rapid and forceful pulse would mean excess heat. And a rapid and thin pulse would be yin deficiency. Rapid and hollow would be blood deficiency. So biomedicine, this is actually febrile disease, various anemias, acute hemorrhagic shock, acute MI, acute pericarditis, congestive heart failure, acute rheumatic fever, myocarditis, and hyperthyroidism. So for excess heat, there is excessive pathogenic heat, increasing the circulation of qi and blood, and this causes the pulse to quicken. So for deficiency, yin or blood deficiency, causes a relative hyperactivity of yang, which causes the pulse to quicken. So physical or emotional activities can temporarily increase the pulse rate. Okay? It Okay, so the rapid pulse or SHU MAI results when yang heat is excessive or yin fluid is damaged. Clinically, there will be restlessness, mental confusion, and delirium. Okay, rapid pulse, which is floating, superficial heat. Rapid pulse sinking, internal heat. Rapid pulse strong, excessive heat. Rapid pulse lack strength, indicates deficiency heat. In adults, the rapid pulse indicates heat. However, in infants, a pulse with 6 beats per respiration is normal. An impatient pulse, which is taut and vibrates to the left and right, like a tightly stretched rope but does not have 6 beats per respiration, is called a tight pulse. Okay? Rapid pulse, which is intermittent, is called hasty pulse. Rapid pulse, which can be felt only at the quant position, is moving pulse. The rapid pulse usually occurs when yang qi is excessive. This can occur in kidney, in heart or kidney fire, and can be either a deficient or excessive condition. The rapid pulse, which is big and strong, indicates excessive fire, and treatment is by cooling and reducing. Rapid pulse, which is minute and lacking strength, indicates deficiency of fire, treated by warming and reinforcing. In TCM, lung qi concords with autumn. During deep autumn, the weather becomes dry, and this aggravates lung diseases, especially those related to lung yin deficiency. Therefore, if the rapid pulse appears during autumn, it indicates excess internal fire burning the lung yin. This type is difficult to treat. A rapid left Sun position pulse indicates an upper warmer disease with heart fire blazing upward. Symptoms: sore throat with cracked or ulcerated tongue. A rapid right Sun position pulse indicates an upper heater disease with dry heat in the lung. Symptoms: coughing with vomiting of bloody pus, lung abscess. Rapid pulse in the left quant position. This is liver fire blazing upward. Rapid pulse in the right quant position. Excessive internal heat caused by stomach fire. Fire blazing upward from the lower heater creates a rapid pulse on both left and right shear positions. Treatment: nourish the yin and depress the fire. Now let's go to assessment. Who would like to volunteer? Mom Tricks? Okay.
Sige. Sige, Doc.
Okay. When you have a deficient short pulse, this means,
Chi deficiency.
of course, irregular or intermittent pulse generally means,
Deficiency.
so this is
Regular.
regularly
Irregular.
irregular. Kasi intermittent, irregular siya. So regularly irregular. So that means there will always be skip beats, no? Pero regular yung pagka-irregular niya.
Mm-hmm.
Okay? Hindi yung, so may pattern siya. This skip
Mm-hmm.
beats. Okay? That's intermittent pulse. Okay, specifically, what does irregular or intermittent pulse mean?
Yin, organ exhaustion, heart disharmony, shock or trauma disorder.
Yes. So specifically, no? Naubos na yung yin. Number 4, when you have choppy or rough or hesitant pulse, these are all the same. No, choppy, it's also called rough or hesitant. It generally means,
Deficiency or stasis, irregular.
yes. Okay. Excess choppy, rough, hesitant pulse means,
Chi and or blood stasis.
what
Food and
else? Yeah.
phlegm. Stagnation.
Yeah. So this is also very common, especially if the patient is in pain. Deficient, choppy, rough, hesitant pulse means deficient, huh?
Mm, Blood and essence deficiency. Fluid loss after sweating or vomiting.
Okay. Swift, swift or hasty or abrupt or hurried pulse generally means
Heat agitating the chi and blood. Irregular.
excess, swift, hasty, abrupt, hurried pulse means
Hyper yang activity. Excess heat. Phlegm heat.
okay, very good. Number 9, deficient, swift, hasty, abrupt, hurried pulse means
Deficiency of the heart fire or heart chi yin deficiency. Possible imminent.
okay. So this is empty heat, no?
Correct.
Knotted pulse generally means knotted.
Cold. Excess yin.
Okay.
Irregular.
So we had a very easy discussion today, the rapid pulse, which is quite common, diba? So thank you very much, everyone, for joining, especially to Mom Tricks. More
Thank you,
power to
Doc.
you. Okay.